We are here with Dr. Ajay Kumar Singh, who's consultant medical oncologist at Sunrise Oncology Center, Mumbai. Unfortunately, Dr. Satyajit Pawar will not be able to join us today. Today, we are going to talk about living well with advanced lung cancer. Uh, we've been discussing different aspects of dealing with lung cancer over the last over the month of November, which is Lung Cancer Awareness Month. So we've spoken about understanding risks, symptoms of lung cancer. We've talked of navigating various treatment options, and today we will talk of how even with advanced lung cancer, there are options available. While lung cancer is often diagnosed at an advanced stage, it affects both smokers and non-smokers, and that affects the type of treatment that you have available to you. So we will be discussing how that influences the treatment options and what are the other aspects of supportive care that you can consider to improve your the quality of life. Also, a reminder to our audience that we will be also talking to Dr. Kumar Saurabh and Dr. Ghanshyam Swas on 28th of November, which is a Tuesday at 7 p.m. India time. Um, Quick reminder to those of you who are new, Patients Engage is an online platform for patients dealing with chronic diseases and for their caregivers to share personal experiences, learn from each other, as well as from healthcare professionals and allied workers. And the main objective is that the better informed you are about managing your condition, the better decisions you will make, and you will also not feel so isolated in dealing with complex decisions. As I said, we are here today with Dr. Ajay Kumar Singh, who's a medical oncologist, and I'm Aparna Mittal. I'll be the moderator for this session. We've always kept patients and survivors at the center of a lot of our discussions and understood the journey of from the patient's perspective. And that's always influenced all that we do. And you can find all of this content on our YouTube channels as well as the website. This webinar series is supported by Pfizer. It's part of their public awareness campaign, and it's not meant to replace or substitute medical advice. So based on the information that you receive here, please do consult your doctor, or you can reach out directly to the doctor on the panel. The views expressed in this video are that of the speaker, and Pfizer or Patients Engage may not necessarily endorse the same. Um, you can post your questions on Zoom, Facebook, and YouTube. And if you do it after the session, we'll try and capture it in the next session. So with that, we will get started. If you have any specific issues, you can also write to us at editor@patientsengage.com. Thank you. So thank you, Dr. Ajay, for joining us today. I know, you've had to rush after your clinic as well. Can we've talked of lung cancer, but if you can talk through, when we talk of advanced lung cancer, what are the stages of lung cancer, and what's considered advanced lung cancer?
So, ma'am, for so any disease, not only lung cancer, but for any cancer, so it generally it originates from some organs like lung, breast, liver, or your stomach. So whenever the or cancer is localized to your that specific organ, so that will be called as a early means early cancer, early stage cancer. So it may be early stage lung cancer or early stage breast cancer. So till the time stage when the disease is still in your organ like breast or lung, so it will be early stage. At that time, we can cure it by removing that tumor by surgery, or if surgery is not feasible because of some other reason, then maybe by radiation. But once that disease goes beyond that organ, like your regional structure, in lung cases, it is the lymph nodes called mediastinal nodes, suprascapular nodes. That time it become locally advanced. S- At that time also, maybe some cases are curable and some cases are non-curable. So that is a stage three. So stage one and two will be particularly when your cancer is localized to your lung. So stage
Hmm.
three, when that lung cancer goes beyond your regional organ like lung to the nearby structures like nodes. So that time it becomes stage 3. And when it goes beyond your thoracic cavity, means chest cavity, you
Right.
to the because lung has a two uh, there are two
Two
subsides,
lungs.
one on
Right.
right and one on left. So even if the cancer goes from right to left, that also become very advanced. Means that called stage 4 lung cancer. So anything going either to opposite side or to beyond the thoracic cavity, means chest wall cavity, like liver, brain, bone, that becomes advanced lung cancer. So some stage 3 lung cancer which are non-curable, and all those stage 4 lung cancer which are non-curable are considered as advanced lung cancer. So
Right.
this is in general, basically how we can define lung cancer so that normal people can be aware
Okay.
this is in the lung or it is goes went beyond the lung.
Beyond the lung. Right. Right. And in India, we typically say that we get diagnosed at very late stages. Again, what percentage of lung cancers get diagnosed late, and what is the consequence of late diagnosis?
So again, ma'am, it is not a fault of the patient or fault of the any healthcare person, because it is again depending upon the organ of origin. Suppose breast cancer, because breast is visible, means it is on the body surface. So any cancer which is on body surface, it can be identified early, and most of the time it is identified in the early stage, which is curable. That is why breast and some of the head neck tumor, and some of the bone tumor which are on the body part, they are detected early. But lung is the as we are aware, it's a air filled cavity, so there is a lot of scope to cancer grow till the time it presents in some form of symptoms, like for pain or sometimes cough or bleeding in the cough. So it
Right.
is not lung is a means our chest wall is a large cavity. Because of that reason, the lung cancer generally grow very well before it can be identified. So in lung cancer cases, if you ask, maybe 65 to 70% cases are detected in advanced stage. Hardly
Right.
15, 5 to 10% cases are detected in early stage, and remaining 5-10% cases are detected in locally advanced stage. So most of the time, two-third of the cases, every two of three lung cancer cases will be non-curable. When it is
Okay.
only one case, there is a chance it may be a curable stage. But
Right.
this is through the breast cancer, because breast is on the body surface and it can be easily palpated and can be detected in early stage. So in breast, most of the time it is detected very early where it is curable, and very rarely it is find that it will be in advance. But in lung, because of the our anatomic structure, it is generally detected very late stages, and most of the time patients present in advanced stage.
Right. And what are the types of lung cancer?
So now, ma'am, now this definition has changed dramatically over a decade. If uh,
Hmm.
if you go by textbooks, so lung cancer was generally defined as a small cell or non-small cell lung cancer based on the
Right.
basic structure of the cancer cells. But now the technologies or knowledge has improved dramatically over the one decade. Now we define these uh, tumors based on the gene structure. Suppose lung cancer, still we follow the basic protocol, like whether it's a small cell or non-small cell. But in non-small cell, again we classify whether it is a squamous or adenocarcinoma. Again, after defining those squamous or adenocarcinoma, we again do the molecular testing, and we test for more than 50 or 100 genes. And based on those genes, we call it as a EGFR positive lung cancer, ALK positive lung cancer, PD-L1 positive lung cancer. So in general, basically, it can be a small cell or non-small cell. Out of this non-small cell is the majority, 85% cases are non-small, little bit having a favorable prognosis as compared to small cell type. Again, small cell majority are adenocarcinoma. Again, it is having a good prognosis as compared to the squamous cell. Again, in adenocarcinoma, you will see the molecular marker with the EGFR. If all those comes positive, then we have targeted therapy for these markers, and again, these classify them as a good prognosis. So
Right.
nowadays,
Right.
it is little bit complex to define lung cancer.
The types of lung cancer, right? So if you look at those that we say, you test for molecular targets, or you check for gene mutation. Does that, why is that necessary, and why should patients go ahead and do the gene testing? And do you always nowadays do that gene mutation testing for lung cancer patients?
So So again, ma'am, as I told you earlier, in last one decade, we had gained lot of knowledge regarding these gene structure like molecular marker. And important is that if you go 1 year, 1 decade back and you check all the scientific data, lung cancer patient was hardly surviving in few weeks, maybe 4 weeks,
Correct.
6 weeks. There is high, I mean, once the lung cancer is there, the doctor will tell you take home. There is no any cure. Let him be comfortable. But
Hmm.
nowadays, in last 1 decade, we learn so much. We gain knowledge so much. Now we know which are the genes. Like once you sit in the car, you know you need to reach Mumbai,
Hmm.
but so there is a driver who is taking you to the Mumbai in a car. So like cancer is a one car, and there is some driver gene, means those genes are driver which are growing those cancer and taking to the destination, which is death. But once we identify those drivers called driver mutations, we just eliminate those driver or block those driver for a particular period, and that is called targeted therapy. So you will give, once you identify that driver which is growing the tumor, and you need to block the drugs. So nowadays, in last 1 decade, we identified multiple drivers and multiple drugs has been developed for each driver. And
Right.
once the patients was given those drugs, now they are living in years. So from few years, from few weeks, with chemotherapy, it improved to few months. But now with these targeted drugs or immunotherapy drugs, now it has grown beyond 5 years. So it is very, means if you ask, in
It's a
cancer, this is one of
positive
the
outcome.
cancer where there is a tremendous improvement in the survival of the patients. So from
Right.
few weeks now, patients are living few years, and as the growing, maybe in a time will come whether whereby these drugs, maybe there will be cure possible. Even nowadays
Right.
also, maybe in thousand one or two patients are getting cure with these drugs, but maybe in later period, maybe with these drugs, majority people will get be cured, or they will be having living to in decades from years.
Right. So,
So
when we
that is
say
the
that.
reason we need to test these genes at least in lung cancer to identify.
Right, right. So, when we say that patients are living longer, are they, from a terminology perspective, patients get very confused, right? So, is it that the cancer is in remission? Is it that it's, cured and comes back? Or is it that it's kind of contained and, you're just managing it? So, how should they think of it? And because we increasingly say that you can manage it like a chronic condition because you live for, a few years with it, right? So,
Mm.
uh, what is happening to the cancer itself and how should the patient understand it?
Yes, ma'am. So here again, basically now, when now also when we are training the students, or when I was training, basically there are only two intentions, whether it's the cancer will be curative or it will be palliative. But
Mm,
now nowadays we are trying to change the definition, because even if you see blood pressure, diabetes, these are non-curable, but people are living these conditions till lifelong with the with some medication which is controlled by the physician. So now maybe even these lung cancer which are coming some molecular positive, so I will consider them as a chronic disease, not a acute threat to the life. So
right,
maybe, and now we are at least in Tata Hospital, we given one more terminology, control, because if you label it cancer as a palliative, na, so most of the people will not give any support to the patients. So that is
right,
when change the palliative to control, because these controls are in few years and we are trying to push it to decades. So maybe that will be the more important terminology, and maybe in some time we will get some more specific definition. But nowadays, at least in TMH and majority of the medical oncologists, defining cancer in three perspectives, whether it's a curable or palliative, or it's a control disease. So
control
mostly it's a
disease.
control disease. As I said you,
I mean,
in
we
thousand
typically have been using
there are
treatable, but I think maybe control
yes.
is a better
So as I told you, in one
terminology.
or in 1,000, we are seeing one or two patients having complete elimination of the disease, but majority are having
Control.
from suppose it's 100, that comes down to 10, but still it remains. So that is why we need to continue the drug, so that as long as the cancer remains controlled.
Right, right. And in your experience in India, what, I know different, I mean, different drugs give you different types of outcomes, but are there examples of, I know you said there are few which get even cured, but on an average, when you look at 5 year survival rates, etc., for lung cancer, which has a targeted therapy available, for people to understand what are the, kind of potential outcomes we are looking at.
So, ma'am, for the common mutations which we are discussing EGFR and all. So now we have scientific data in from Western, from US population, even from Indian population. At least EGFR patient almost 44 to 50% patients are surviving beyond 5 years. And
Right,
I was part of the TMH, and there were multiple trials running for EGFRs. So I have seen patients who are following for 12 years and 11 years. So it's like wonder
yeah,
to see a stage 4 cancer patients which were living only few months. Now they are for 12 years, there is no disease, and they are following with us as a part of
right,
trial. So
great,
similarly for ALK, now we have data approximately 65 to 70% patients are surviving beyond 5 years. So you can imagine what are the importance of these molecular markers and these targeted drugs.
right,
And
right,
similarly for immunotherapy also, the one of the maybe all cancer patients, those who are related to cancer treatment, they are aware immunotherapy. So even in immunotherapy also there is data now, approximately 30 to 40% patients with lung cancer are living beyond 5 years. So, and these are no molecular negative patients. So even those poor patients also, if they can take the immunotherapy drug, can live beyond 5 years. There is a one third chance ki out of three patients, one patient will be living beyond 5 years.
5 years. Okay, thank you. So, one of the things that people always talk about is side effects. Now, we know that um, we've had these discussions in the previous one that for some of these targeted therapy, it's not side effects like you have with chemo or radiation, right? So, but there are long-term side effects sometimes, or there may be toxicities that the patients should be aware of. So can you kind of shed light on some of the, long-term side effects and toxicities? And I know some patients have talked to us about onset of diabetes or gastro issues or skin rashes, etc. So if you can talk us through some of those kind of
So,
side effects and toxicities.
so ma'am, if we go by each modality, suppose chemotherapy. So obviously chemotherapy has its own side effects. But means nowadays also when I say see patient, I mean I advise chemotherapy patients just pattern. But believe me, for last 6 years, um, uh, there are few patients who suffered a severe side effect, but majority out of 180 or around 90-95% patients had tolerated chemotherapy well. And now this is because more and more qualified doctors are coming who are treating the patients, and more good hospitals are coming who are able to manage these side effects so that the severity grade is not increasing. So there are common side. If you go with chemotherapy, you will feel nausea, vomiting,
Mm,
some loss of appetite, and then your blood counts will go down. You may get infected. But nowadays, with a good qualified doctor, if you are taking under good qualified doctor with good, if there is a good physician support and good hospital supports are available, these side effects can be identified early and can be taken care of. Only very few number of the patient I have seen are suffering from severe side effects. So obviously with chemotherapy there are side effects, but nowadays because of the improving health structure in the India, these are become very less, and
much
even
less.
those who are developing it is very easily manageable if you explain the patient how to inform the doctors.
Harmful.
I know if you need to visit the hospital, so they are following the advice. The chances of getting severe side effects are very less. Similarly with target therapy, these are the one of the safest drug, but still as you said, these patients will get skin rashes, some liver dysfunction.
Mm,
Sometimes they may get pneumonia-like symptoms. So, but the numbers are very less. Even it is less than 2% or less than 1%. But the benefit is very huge. So you no
right.
need to worry. But again, here again, we need to, as a doctor, we need to explain the patients what they should take care, and even once we start the therapy, we have protocol when to follow up the patients. At least for initial 1 or 2 months, we follow the patients very strictly on weekly basis or every 15 days, so that these side effects can, whenever it occurs, it generally occurs in first few months. So at least
Right.
for 1 month or 2 months, we follow the patients very strictly as per the protocol, so that any side effects develop, we detect it early, so that to avoid the severe side effects. And with dose modification or dose interruption, that can be again easily modifiable. Again, immunotherapy like targeted therapy is again is one of the safest drug as compared to the chemotherapy. But again, 2 or 3% patient may suffer some severe side effects. Again, if you with proper counseling and proper education, these are very there are very less chances that patient will have some severe side effects. So out of 100, hardly one or two patient will suffer and they need to stop drug. Otherwise, 98%, 99% patients are tolerating treatment very well. So these are
Right.
targeted and immunotherapy drugs are now very safe drugs, and patients are also happy. They are able to perform their family duty, their social duties, and
Correct.
country duties.
Correct.
They
Correct.
are not need to sit at home and take rest. They
Yeah.
just take a pill and go to your work, perform all your duties.
Yeah, no, that is true. I think we've seen more and more patients talk about how they are able to continue work, even on treatment. And it's also to your point, right? Because survivorship has improved, more patients are coming forward to talk about their survivorship. So I think it also it allows other people to listen to patient stories as well, even more. Coming back to, I think you talked of how initially the follow-up routine is high and then later on you may reduce the follow-up. But are there specific, advice that you give to lung cancer patients on role of nutrition during the treatment or even otherwise as a lifestyle change?
At all point, nutrition performs very important role because with cancer also, one of the symptom of cancer is patient had loss of appetite. They will lose weight, and once the patients start losing weight, means their protein level, albumin level goes down. And these drugs are basically in the body, they get bound to the protein. So, and once they are in bound to the protein, they will not affect your normal organs. So we counsel the patient to have a good diet, maintain their weight, so that their albumin and protein level remains well, so that the drug side effect can be avoided. So most important part from my point of view, we counsel patient, we refer to dietitians also, but sometimes I find some dietitian, they give lot of restriction not to eat
Mm,
sugar, not to eat juices, and that troubles us because patients are already, we don't know how long they will survive, so we generally don't want them to suffer in that perspective. So at least from my OPD, I was counseling all patients whatever they like, except for diabetes or renal, if they are kidney patient, follow that diet. Otherwise, those who are not diabetic, non-kidney patients should whatever they like should continue the same diet. They should not lose the weight, and also to concern the dietitian. But I'll advise them, if they are not happy, just whatever they like, just continue the same diet. There's no,
mm,
so my reason is just to maintain the weight so that drug side effect can be avoided. Once your
right.
protein and albumin level is goes down, na, so that more and more drug become free in your blood, and those goes to your organs and they damage more. Better to
Okay.
take any of the drugs to maintain the weight.
Right, right. So you're saying that weight loss actually makes the symptoms much worse as well, the
Just
side effects.
once the weight, the side drug side effects increases.
Sorry, we are losing you a little bit in terms of the connection, doctor.
So yes, ma'am. So once patient loses, the side effects are also increases, and that is indirect sign your disease not very good control.
Right, right. Okay. And in terms of exercise and rehabilitation needs, what are the areas that lung cancer patients should be looking at?
So all parts are important, ma'am. Even we encourage they should do some, because your lungs are affected because of the cancer disease. So sometimes patients feel breathless. So we generally advise them to do some physiotherapy or yoga exercises so that their lung capacity remains maintained. They should not feel breathless. And maybe because with period their disease ultimately going to grow. So if you do a good exercise, you maintain your muscles and your breathing capacity, your symptoms will be very less and you will be able to do your routine. So all these
Right,
are supplementary part, but perform very means needed very well for the patient so that they can do their work. They should not remain in the bed. They means that also gives some psychological benefit to the patient. They are feeling better. They that motivate the patient to continue their regular routine, not to hamper.
right, right. And you talk of loss of appetite and maybe weight loss as well, but do you also see cases of, as the disease progresses, do you also have to watch out for sarcopenia and cachexia? And if so, then how do you support, what kind of support and advice would you give to patients who are in that stage?
So yes, ma'am. If suppose someone going in cancer cachexia or sarcopenia, then that is the worst sign. So in that case, again, then we need to land up with our dietitian. We need to make a good plan so that their they should get some weight. Their appetite should improve. But again, those are very some poor signs. But still, if that scenario comes, then we need to have a good managing team, including dietitian. And even if that not improving, then there are some pharmacological preparations are available like magistrol and some other steroidal preparation, which helps patients to improve their appetite and gain some weight. So then we need to form the team, and we need to go step by step with the dietitian consult, and if not, then pharmacological intervention.
Right. And in terms of best practice nowadays, palliative care is not just seen as end of life, right? It's seen as an integral part of care. Uh, Again, do you tend to bring in, I know you mentioned initially that people don't like the word palliative, but how do you address, those needs of patients without, do you use the term palliative with them? Do you bring in a palliative team, or do you try and avoid the term palliative but address the support requirements?
So, ma'am, for all advanced stage patients, we are start involving our palliative team from upfront. Not only means even if they are not needed, but just to keep them in loop so that in future, whenever there is a need, this palliative team should be aware. They should be aware of what are the goals of the patients for the future. So that
Right.
once the palliative team starts interacting with the patients early, na, they then get aware ki what are the
Mm,
patient's future goal in the life. Even though at present patient is very well, but we know ki in few years or few decades, patient will be going to get trouble with the disease. And if palliative teams is already aware ki what are the patient's goal, suppose someone is right now in 50 and their children in 12th standard,
mm,
they
mm,
must be having some goal ki in next 5 years their children get some professional degree like engineering, doctor. So that they should be aware ki what are the needs. And some, because we as a medical oncologist in OPD, we are very busy. We are not having that much time to
correct,
interact the patients to discuss
correct.
their personal goals. But sometimes in palliative team, they have a dedicated person who can interact with the patients, find out their needs, and and they indirectly hint us what patients want. And in that team manner, we are able to make some personal plan so that patients at least fulfill their last wishes, whatever they needed. So
Right.
palliative team means palliative for advanced, which is a non-curable disease. Palliative team is an important part of the team, and we should not hesitate to inform
Mm,
the patients. And at least in TMH and now also in my private practice, I'm start counseling my patients to consult with them so that even at local place sometimes, because most of the patients come from outside in Mumbai and they go
correct.
back to local. If they are in palliative team consult, they give the reference of local palliative team. If sometimes some emergency happens, they can coordinate with the local team and get sorted out.
Right, right. Yeah, no, I think it's still an area which often patients and their families don't fully understand. So we thought we should at least start talking about it. The final message from an emotional and psychological need for both the lung cancer survivors and their family. What do you typically advise and how do you support them?
So nowadays, if anyone that is what if anyone get diagnosed with the lung cancer, they need to worry even if it is advanced stage or curable stage. For curable stage, obviously there is a cure, so you don't have to worry. You need to face that challenge and you need to get cure. And even for advanced stage nowadays, so many new drugs are available. So better you meet your qualified doctors, consult them, and follow the protocol. And maybe you will be living in decades till normal. Maybe live your full life with the simple drug or pill, simple pill. So for lung cancer nowadays, I think one of the malignancy which is doctor now happy to treat, not be a decade back where they were not able to want doctor to treat lung cancer. But nowadays but for nowadays, we are happy to see lung cancer patients guide them because we know there are multiple therapy options. and we
Right.
counsel them regard, and also we try to avoid, whenever there is not needed chemotherapy, we are trying to avoid the chemotherapy for acute side effects, also for long term side effects also. But
Right.
lung cancer is one of the good means no, one of the malignancy, not good, but we have a lot of options, and you will be able to live long and happy life if you are consulting a good doctor and good team.
Right. Right. Thank you, Dr. Ajay. Any final message to our audience? I know we've been speaking for about 30 minutes now, so but any final message to our audience?
Uh, from my side, I'll wish you all the patients to stay happy and stay healthy, and don't worry about your lung cancer. Just
I think you're on mute, Doctor.
thank you, ma'am. Thank you, and thank you, Pfizer team, for the opportunity.
Yep. Thank you, everyone. And thank you, Dr. Ajay, for joining us today and, answering all of these questions on especially dealing with advanced lung cancer. And as you've rightly pointed out, that, there are many more opportunities now and options available for patients navigating this. So it's no more as it was even a decade back. So I think it's really heartening to see the kind of progress there is. And we hope that people will kind of take uh, feel positive about the prospects of lung cancer treatment going forward. So thank you once again, Dr. Ajay.
Thank you, ma'am. Thank you, everyone.